Dr. Santiago Mazuelas, good afternoon.
Good afternoon.
You have been selected by the AXA Research Fund to conduct your project on early prognosis of COVID-19 infections via machine learning. Can you please share with us the main goals of this innovative research?
Yes, thank you. The main goal of this project is to develop machine learning techniques that predict the future severity of COVID-19 infections using health data obtained at the time of infections detection. These predictions could be used later by medical personnel or public health stakeholders to take timely decisions that result in favorable outcomes. The complex relationship between health data and COVID-19 future severity will be learned from numerous training samples corresponding to asymptomatic, moderate, and critical cases. The project main goal will be achieved by first developing data processing techniques that obtain accurate training samples from sequences of health records. Then we will develop supervised learning techniques that minimize cost-sensitive predictive errors, account for selection bias, and maintain data privacy.
Thank you very much. That's very clear and that's very exciting. And this is a project which raises lots of hopes.
Yep.
And regarding these hopes in the current pandemic, time-wise, what is the expected time frame of your project, and how quickly should we expect the first outcomes for application during this enduring health crisis?
Yeah. So we are currently processing initial datasets with health records corresponding with over 2,000 patients infected in the spring of 2020 and treated in several Spanish hospitals. We expect to have preliminary results in a few months and have a fully operative set of algorithms in less than 1 year. By the end of next summer in 2021, we will evaluate the performance of the developed techniques and obtain feedback from physicians and other representatives of the health system. In the next 2 years, the project will concentrate on further enhance the algorithms by addressing important issues such as selection bias and data privacy. At the end of the project, we expect to have a complete methodology for the prognosis of COVID-19 infections that obtains accurate and timely predictions while maintaining the privacy of electronic health records.
Thank you very much. So I understand that we will get first finding quite soon, more to come soon.
Yep.
And looking further, even after the 3 years of your project, how do you foresee the replicability of this research, and particularly for other potential pandemics in the future? Could it work, and how?
Yeah. Okay, so the machine learning algorithms developed will learn to predict infection severity using specific datasets, with health records corresponding to different categories of COVID-19 patients. However, the methodology that will be developed could be used with general datasets. We foresee that the same learning techniques can be utilized with different populations and for different pandemics and virus mutations. For instance, the learning methodologies developed using health records corresponding with Basque patients could be used to obtain algorithms that learn from health records corresponding with other regions or with more comprehensive health records from large-scale populations. We could therefore better understand and anticipate patients' reactions to other viruses or in other regions and countries.
Thank you very much for your time and for all this information. All the best for these very innovative projects with, again, lots of expectations. It's going to be very helpful to have all your findings. We keep in touch for knowing more about the findings. And well, thanks again. And bye-bye.
Thanks to you. Bye.
Thanks. Bye.
Bye.